Hi, in this video, I'm going to talk about risk factors for lymphedema. First, I'll start with an explanation of what lymphedema is, how it develops, and then what are some things that may contribute. Before I go on, I'd love to have you subscribe to our channel. We put new content out all the time, so it's very likely you'll find something else of interest. So what is lymph first, and what's lymphedema? So lymph is fluid. It's really clear fluid that circulates throughout, or milky fluid that circulates throughout our body, and it's responsible for clearing things up in the body. So we have a lot of white cells. That's why it's white, actually, or creamy colored, because of all the white cells. And the lymph travels through multiple parts of our immune system, like lymph nodes. It travels through the spleen, and it is responsible for a lot of fluid balance in our bodies. If our lymphatics are blocked, we can get swelling. So people will occasionally get huge swelling of their legs, and that's not always from lymphedema, but it certainly can be. The lymphatics and the lymph nodes are tightly related to one another. They're part of the same system. And we have lymph nodes that drain the breast and the armpit and inside the chest. And also lymph will drain the skin. If we have treatment for breast cancer that disrupts the lymphatic system, you don't see that fluid flowing as freely, and it can kind of get backed up. So if you imagine a water hose and you step on it and block it, it can inflate it can sort of increase in size on the other side. These are the cartoons we see where somebody steps on a hose and the hose gets really big until the blockage is released. So that's lymph. And then what happens with lymphedema is the channels and the free flow of lymph fluid are disrupted. So what increases the risk for lymphedema? Well, breast cancer treatment does. So we're trying, of course, to remove the tumor and assess the lymph nodes and remove any positive lymph nodes, but surgery will disrupt the lymph channels. Surprisingly, this doesn't happen in everybody. This may have something to do with the technique of the surgeon. So this is not to say if you have lymphedema that the surgeon did something wrong, but the reason I say it's related to surgical technique is because we see less and less lymphedema than we used to. So in the past, surgeons would take a very large block of tissue from the armpit, and we'd see lymphedema much more often. And sentinel lymph nodes are preferred instead of a full axillary dissection, unless you have positive nodes. Sentinel lymph nodes are preferred because we see less lymphedema. We don't see zero, but we see less lymphedema. We tend not to see lymphedema with removal of just the breast or just a lump in people who don't have lymph node dissection, but we never say never, and I've seen it a couple times. Just because the lymph drains through the skin, and if we cut that, we can see lymphedema. Surprisingly, we don't see this in a lot of other areas of the body with lymph node dissection, but it can occur. My thought about this is that the lymph channels in the armpit are subject to a lot of force because we move our arms around a lot, whereas other parts of the body where lymph nodes are removed, we don't tend to see as much pulling and tugging on those areas. Now, this is not to say you shouldn't move your arm. In fact, one of the most frequent risk factors for lymphedema is immobility, not moving the arm, and I'll get to that more in just a moment. So when lymphedema happens, I want to be really honest with you. We are always honest with you about what we don't know. We actually don't know who's going to get lymphedema. I can't say, looking at an operative note or even being in the operating room, this person will get lymphedema based on number of lymph nodes that were removed or the extent of the lymph node dissection or who the surgeon was or how quick they were or how careful they were. We just don't know. We do know that immobility, like keeping your arm frozen, not moving it around, and babying it, not using it, increases the risk for lymphedema. A very large randomized trial, actually it was a small randomized trial that's been confirmed, shows that mobilizing the arm as soon as the surgery site has healed decreases lymphedema. So you may have the sense that you shouldn't be doing things with that arm after a lymph node dissection, let's say on the left side, and that's actually not true. Lifting weights, gradually increasing the weights, working with a physical therapist if you have access to one, can help actually decrease the risk of lymphedema and improve your strength, your posture, your function, etc. One thing we do know can increase the risk is injury to the arm, especially punctures of the skin that are not clean. So I'm not talking as much about an IV, although if you have another arm, we do recommend that an IV put in on the side that didn't have the lymph node dissection, and you might prefer to have your blood pressure taken on the other side. There's no real evidence that sterile technique will increase the risk of lymphedema. So if somebody draws blood on the other side, on the side that had the lymph node dissection because you don't have a great vein on the other side, it's okay as long as sterile technique is followed. In other words, the area is cleaned and people are wearing gloves when they access your vein for blood work. We do know that having an infection on the site after a bee sting or a puncture wound will set up infection often in the skin, and because the lymphatics have been disrupted, your body might not be able to fight infection as well. And once we see one episode of an infection, cellulitis, which is infection of the soft tissue, we see people at greater risk of another infection and of lymphedema. It just makes sense, right? Because we're bringing a lot of blood and lymph into that area, and it can get kind of congested. We do have a video on treating lymphedema and preventing lymphedema that I would encourage you to watch. But the key thing is get treated early for any infection. If you have a bee sting or a pricker, clean the area out just as soon as you can. Wear gloves if you're out gardening. Protect your hands and arms. If you get lymphedema on your chest wall, you can wear a compressive garment. Physical therapy is highly effective at treating lymphedema, and we recommend treating it early. Don't wait till the lymphedema is established and has kind of moved in and set up house. So I've covered quite a bit today. I hope it's been helpful. Drop a comment or question below. We try to get back to you as soon as we can, and sharing your story is really helpful for other people watching these videos. Thanks for watching.